Um, so thinking a little bit about one of the things that we've talked a lot about, and many of you that are here today are from the beautiful Commonwealth of Pennsylvania. And while I reside and practice out in the southeastern part of the Commonwealth, I've had the good fortune of visiting 42 of our 67 counties over the course of my life. And one of the things I've learned so much in the work that I've done in our Pennsylvania Medical Home Program and from the providers through the American Academy of Pediatrics and the work that we've done is that I think about the various counties that we have in our Commonwealth, and sort of thinking about the beautiful Commonwealth and that I'm so proud to live in and be a part of. But thinking about those, we really need to think about those things in our day-to-day lives as parents, as EMS providers, as clinicians, as community partners. Next slide, some of our quick facts. So our population is close to 13 million now, and about almost 21% of that population is less than 18 years of age. So we have about a 500,000 or 500,000 children with special healthcare needs. And if you remember my pyramid that I showed, about 0.4, about 1% of those are the children with medical complexity. And I just had to put in a plug for Philly sports because I have converted many people across the years to our amazing sports teams. So here's a map of Pennsylvania and those beautiful 67 counties that we have. And I just think it's important, especially for those of us that might be in our area, to really like this color visual where you can really see in here the green counties are those that are designated by the Census Bureau as rural, and the blue are urban. So you can see that, by far we have many more rural counties than urban counties. And I just think it's always important to see beyond where we live and understand our families, our partners, our communities, and our children. So I wanted to, again, just kind of pause here and thinking about that child that I asked you to think about early on. And can you think a little bit about, oh, look I got some Pittsburgh fans in the chat there. It's okay. I still love you. But can you think a little bit about what are some of the biggest geographic challenges that you think maybe families or first responders may experience? Or I know for some of you, you're actually experiencing it, you're living it. So I just think it's great for us in these settings for us to, develop some empathy and understanding of what our various colleagues in different areas might be experiencing. As I mentioned, Stephen talked a little bit about, just response time, that it actually, where he is in Pike County, that, it usually is 15 minutes to get out to respond for an emergency. So think if anybody, wants to share anything in the chat about that. Sometimes and also thinking about storms, which no matter where you are, might limit that. There's also sometimes can be, funding that affects some of our rural areas. And also just, that's why I think the role of EMSC in these trainings and public health outreach. And thank you. Yes, we've got some considerations that we have here that you guys are all bringing up here, which is wonderful. The transportation, the road access, sometimes remote addresses, even with, I don't know what we did before GPSs, but sometimes that can be difficult to find. And resource limitations that I mentioned, the training, the equipment, infrastructure. Some of you talked about this, traveling for access to healthcare, for higher levels of care. I know I was up in one of the counties north of here, and one of my pediatric colleagues was talking about how just they always, they don't have a NICU that takes care of, really fragile infants, and just how they are always having to fly them out. Limited funding, we talked about that a little bit. The greater geographical areas to cover. So like to Stephen's point, longer response times because you're crossing multiple counties, and certainly the demographic challenges and population density. So you might have, more elderly or residents with disabilities.